Hello, welcome again to Your Pet, Your Vet. Today we have an exciting show. It's actually a two-part segment. We talked last time about what goes on, and we walked you through when we do a simple surgery or surgery, and we talked about the spay, or what's also known as the ovarian hysterectomy, the scientific term. Well, today we thought we'd be kind of bold, and we're actually going to show you a surgery. The first segment, though, we're going to show you what is involved in getting ready for the surgery, getting the pet ready, getting the veterinarian ready, getting the surgery suite ready, and everything. And then next week, you need to tune back in, and we'll actually show you the surgical procedure. We'll start with the kitty cat here that has come from a rescue group. We do a lot of surgeries here for clients and also for rescue groups. This is actually a rescue group kitty that was sent here because we help them with reduced cost service. All right, here we are. This is Tipsy. Tipsy's a young gray tabby, domestic short hair, and we have Kristen here as our veterinary assistant, and Yael Marie, also another veterinary assistant that works with us. And Tipsy is having her pre-surgical exam. This is what we do to make sure everything's okay. So Kristen's going to walk you through how we do that. I refer to it as a tip-to-tip exam. We check their face, check their mucous membranes, their teeth, make sure everything's okay, make sure there's no problems that the client's not aware of, check their ears out. And then just kind of slowly go about the process, keeping the kitty happy. She'll check the abdomen and listen to her chest, make sure there's not any heart problems that probably are not obvious. So as you can tell, it's a comprehensive exam. We don't want any surprises, so this is how we make sure that happens. In order to do that, of course, we get the stethoscope out. Kristen is well trained and knows what to listen for, heart and the lungs. The secret is to keep the kitty cat calm. The way you do that is just basically pet the kitty and reassure the kitty. And that's how cats are like children. They have to be reassured. Dogs too, for that matter. So as you can see, once we determine that the kitty cat is healthy, then we move to what we call the pre-anesthetic injection. This is a shot that actually allows the pet to relax. It also has an analgesic component for pain management. And then we give this in the muscle in this case. And Chris is going to show how easy this is. And what Yael Marie is doing is she is scruffing the neck, and that sometimes is necessary, not always. And then she's going to distract the kitty. She does that. There she goes. See there? Very good. And then she starts petting the kitty so the kitty cat will relax. Then we're going to go to the ICU area so the pre-anesthetic can take effect. And then we'll move to show you how we prep them up and get them ready for surgery.
In order to prepare for surgery, the first thing I have to do is wash my hands and then in a sterile manner put on a sterile drape and sterile gloves.
This is Dr. Al Marshall. He does a lot of our surgeries, a very skilled surgeon. We're blessed to have him here. And you'll see what's so important is that this is a sterile procedure. Biggest complication in surgery is a human introduced infection. So we make sure that doesn't happen by prepping up appropriately, not only the animal, the pet, as you'll see in a minute, but also the veterinarian has to get himself ready so that he's is also in a sterile type of condition, if you will. Okay. Yael Marie will be stepping in here, the veterinary assistant we introduced to you earlier, because Dr. Marshall needs help getting dressed. This is important because we don't want him to be contaminated. We always make sure that the gown is pulled up over the shoulders so that he's comfortable, which Yael Marie will be getting to directly. As a surgeon, I know how it's important to be comfortable. You can even see there's a proper technique to how you put on your gloves. I remember in veterinary school, this is one of the hardest parts I had to learn. We have 4 different surgeons that work here, so we have to have different size gloves for the different surgeons. Some veterinarians do surgery standing. I'm one of those. Dr. Marshall likes to sit, and that's perfectly fine. We have adjustable tables so to make sure the pet's properly positioned and the veterinarian's comfortable. Once Dr. Marshall is all ready, he'll make his way to the surgery suite. And then we'll bring the kitty cat out who will get prepared for surgery. Okay, Tipsy's getting prepped up now. As you can see, Angela now who's helping us, she is shaving the area. You can't really make an incision through hair, so you shave the hair away very neatly. And then that allows us to get to the skin. In kitty cats, the incision is made between the umbilicus, which is approximately right here, and the pelvic brim, which is right here. So we're going to be making an incision right between those two locations. Those are anatomical landmarks. So now we're using a vacuum. We have a central vac in the animal hospital, so we can get the hair out real easy and completely. Now we're using a surgical scrub to clean the surgical area. This entire area will be prepped. This is where we're putting some drops into the eyes to keep the eyes lubricated. You don't want, one complication of surgery is a corneal ulcer, and that's the way you prevent that. Cats are a little bit trickier to intubate because they have a situation called laryngeal spasm. Dogs don't do this. That means if you barely even the slightest touch, just the slightest, the larynx will tend to spasm. Our team is extremely skilled at this and oftentimes can intubate. Sometimes you have to use a local anesthetic on the larynx to just kind of relax that larynx to where you can easily pass the trach tube. Whatever's in the best interest of the pet is what we do here. All right, we've had success, and now she's using a rubber band to place around the ears to keep the trach in place. Then the kitty cat will be placed back on her back, and then she'll be hooked up to the anesthetic. Are we using the non-rebreathing?
Ready to transport.
Oh, they're ready to transport. Boy, that's quick. So now we're going straight to the surgery suite.